Can thick white discharge be a sign of preterm labor?
Hey there! Welcome to today's video, where we'll be discussing an important question. Can thick white discharge be a sign of preterm labor? It's crucial to understand the various signs and symptoms of preterm labor, as it can have serious implications for both the mother and the baby. So, let's dive in and find out more.
What is preterm labor?
Before we address the question directly, let's first understand what preterm labor actually is. Preterm labor refers to the onset of labor before the 37th week of pregnancy. Typically, a full-term pregnancy lasts around 40 weeks, so preterm labor occurs when contractions and cervical changes begin too early.
Common signs of preterm labor.
Now that we have a basic understanding of preterm labor, let's explore the common signs that indicate its onset. Keep in mind that experiencing one or more of these signs doesn't necessarily mean you're going into preterm labor, but it's essential to be aware of them. Regular contractions that occur every 10 minutes or more frequently. Menstrual-like cramps, persistent, low abdominal pain or cramping that may feel like menstrual cramps. Pelvic pressure, a feeling of increased pressure or heaviness in the pelvic area. Abdominal cramping, sharp or dull abdominal pain, often accompanied by diarrhea or upset stomach. Backache, a constant or intermittent dull ache in the lower back. Change in vaginal discharge, an increase in the amount of discharge or a change in its consistency, color, or odor.
Understanding vaginal discharge.
Now, let's focus specifically on vaginal discharge. It's normal for pregnant women to experience an increase in vaginal discharge throughout pregnancy. This discharge, known as leukorrhea, helps maintain the cleanliness of the vaginal area and prevents infections. It's typically thin, milky white, and odorless.
Thick white discharge and preterm labor.
To address the main question, can thick white discharge be a sign of preterm labor? While an increase in discharge is common during pregnancy, a significant change in consistency, such as thickening, could potentially be a cause for concern. However, it's important to note that thick white discharge alone is not a definitive sign of preterm labor.
When to seek medical attention.
If you're experiencing a substantial change in your vaginal discharge, especially if it becomes thick, it's crucial to consult your healthcare provider. They will be able to assess your specific situation, perform any necessary tests, and provide the appropriate guidance. To sum it up, while thick white discharge can be a cause for concern, it is not necessarily a direct sign of preterm labor. It's vital to pay attention to any significant changes in vaginal discharge and consult your healthcare provider for a proper evaluation. Remember, it's always better to be safe and proactive when it comes to the well-being of you and your baby. Take care, and we'll see you in the next video.